We Speak is homegrown Windsor Essex partnership success in motion. And We Speak logo, you'll see it there. Your own wonderful Sarah Fram helped us with the branding so that we could take all the participating logos and make it familiar, simple, beautiful. I would like to take you through a little bit of the history of this work, and it really highlights the power of bringing the voices of the community to the planning, and then having leaders organize themselves to be able to respond. So back in 2012, it all started with the little stat from the census that the WeLip shared kind of tirelessly, I would say, that 1 in 4 in the community identify as an immigrant. And so that little stat needed to be brought a few different times to the planners in order to say, I think we need to look into this. Then there was an additional stat that was brought from a survey that the LIP worked on with the University of Windsor that said 42% of those surveyed relied on the emergency department for their primary care needs. So when that little piece of information went to the LIN, it was, oh, maybe we do need to take a closer look and figure out, is there a simple solution? It seems like we're failing newcomers and immigrants in not providing the appropriate access for healthcare. So we created an event together. And so this is what the LIP does well, is rally the community. And many community partners sort of pitched in to create a community engagement event that we called Listening to You. And we thought we'd have 25 participants. We ended up with over 120, including healthcare providers who said, would you create a separate table for us? We really want to be part of this discussion. So language specific tables where we got a huge list of what we could do better. But one of the pieces we heard loud and clear was, your healthcare system is very confusing to us. You really need to coordinate yourselves and help us with those access barriers. So one of the ways we responded was to create a committee, which we called the HENI, Health Equity for Newcomers and Immigrants, where we strategically planned, we did a service inventory, we started to connect all of those dots, and we sort of pre-drafted a business case to do a better job of creating those transitions and connections to the different points of healthcare. Who knew that 1,400 Syrian refugees were going to come to our community? And so we were very fortunate that we had already started some of this collaborative work. We had a business case ready to go, and the LIN was able then to provide some funding to the VON. The LIN funded the VON to create what was known as the Immigrant Health Clinic, which is still running, and I believe is finding a new location these days. And so it goes, and life goes on, and we continued our strategic planning, and we continued to address the needs that were brought forward to us, but it was time to regroup with the community. So we again met with community members, newcomers, immigrants, their families, and providers of various sectors, and we called this one Chat, where we asked one question: if you could change one thing about the healthcare system, what would it be? And overwhelmingly, it was language. This is a top barrier to achieving equitable healthcare access. It's an issue and a concern both for providers and newcomers. And so the LIN as well at the same time sent out a provider survey, which we also received many key areas to address. But one of them was 90% of the providers reported they rely on family members to act as interpreters in a healthcare encounter. So we knew it. We know it anecdotally. People share a lot of stories. They have personal experiences. But to know that 90% of the providers had the confidence to be honest that way and say, we rely on family members for whatever their reasons were. And in some cases, it was part of policy. So we knew we had some work to do, and we created a project team. So once again, we look to the LIP and we say, can you help us bring together leaders across sectors to see how we might simplify things? How could we create a centralized access point so that regardless of where the professional interpretation is, and we know locally that's the Multicultural Council for in-person, and also what about language line, or what about these new video opportunities? We wondered if OTN might be a solution. And so the We Speak project team was born. Again, there's that wonderful logo that allowed us to be multiple players at the table, all using the same branding. So we were part of one team, and we were able to centralize that access, which I'll go into in a moment. The next piece here as well is the Workplace Wellness for Agri-Food Workers Task Force, again supported by the LIP, helps us to centralize access to supports for that particular population. Well, I'll just tell you, what is it anyway? What is We Speak? Well, it was an acronym, Windsor Essex, everything starts with we. And it's a centralized access point by a 1866 number and over the web, which would give us access to professional interpreters either by phone, by video, and live in person when that becomes more readily available. It's 180 languages plus, which is, readily available 24/7 for most of them. And it's the lowest possible cost. So because of the volume of participating healthcare providers and their usage, we're able to keep the cost as low as it can possibly be in a bulk purchase arrangement. And so this makes it a little bit easier for those that don't have a large budget for interpretation to access this service. This particular service doesn't have a monthly fee or a licensing fee. We are working on regional funding, which fingers crossed we will be able to achieve. But as it is, our providers know this is important, and so they've dedicated their own budgets to pay as it's needed. You might ask, why is this more important than other competing priorities these days? And so we have prepared a list of why it's important for you. And I won't read each of them to you in the interest of time, but each of these points will resonate differently with different people who read them, depending upon your work, your personal experiences. But we've bolded a couple of the really big ones, which is the impact of language barriers can lead to misdiagnoses, increased risk of hospitalization, all of these things that none of us wants. And it's really just as simple as removing the language barrier. We also wanted to show the benefits. So, how does this help? How does this project help? And again, you'll see various examples, and some of them are bolded that say, well, it can shorten your wait time, it can shorten your visit time. It eliminates unnecessary workload for the provider. It reduces clinical errors. So isn't that nice when there's a fairly simple solution, and that's just make sure that you share the same language as the person that you're serving. This is just a bit of a snapshot from the emerging Ontario health teams, and they're focused on something called quadruple aim. Really, it talks about, what are the 4 areas of work that are the most important that we could focus on? It's better health outcomes, lowest cost of care, improving the patient experience, but also improving the provider's experience. And I think in earlier iterations, it was called the triple aim, and then it was amended to include the provider experience. I'll give you some quotes that we've obtained as we've moved along. The one on the left is from a nurse practitioner who said to us, it's so easy to use. If I'm not able to access a video interpreter in short order, it rolls right over to audio. I can use it along with other staff that need to use it simultaneously. So some of the examples you hear is, yeah, we have someone who speaks a language of need in our organization, but if they're busy with a patient, we have to wait or we have to reschedule. So this was really helpful for us to know that it's accessible by the whole staff. And then a patient perspective. This was a patient of a primary care provider who said, this was a relief to me. I always worry if I understood the instructions well from my provider, or if I misunderstood and gave the wrong answers. I can't always rely on friends and family to be available, and then to also help me understand. So when you think about friends and family, if they're not a trained professional interpreter, they may also struggle to understand the medical terminology and to relay the appropriate treatment options. So powerful voices. This is the part where we get to how it works. So what exactly is the access to the service? And so in order to access the service, you simply set up an account with a We Speak participating service provider. So locally, that would be Multicultural Council, or directly with the Rio network. And we facilitate that. So the beauty of having a branding and a 1866 number is the provider doesn't need to know 17 phone numbers or email addresses and so on. They just need to know how to access it. So those who gain access are given a code to access the immediate, which I'll talk about in a moment and give you an example. So it's on-demand video or audio. You can also pre-schedule, but you get codes so that you can access it kind of in 5 minutes. They'll help you with step-by-step instructions. So for people like me who are technologically challenged, that makes a big difference. There's also onboarding support and training for organizations, small or large, to make sure that it just becomes second nature. And once you learn how to use it, so easy. This is a beautiful flyer that we created that was meant to be simple, attractive to the eye. And you'll see the subliminal messaging behind that says you want to avoid errors and confusion and miscommunication. So you want We Speak. And so underneath there, you'll see where it changes to the lovely pink: patient safety, quality care, improved experience, value, equity. And really, when there's a language barrier, it's a safety issue. And that's the message that we wanted to portray. It also shows it's a simple 1866 number to access all of those services. And the website is there, which points to the Workforce Windsor Essex website. So we're so grateful for that. Health equity, when we have a chance to perhaps go into it a little bit further, I'll just really quickly touch on this diagram that's shared by Health Quality Ontario. And it shows that health equity has many sort of pie wedges. So that's inclusive care, it's culturally safe care, it's all about data and safe collection of data, spiritual care, partnering. So again, that theme about partnering, and language is a very important slice of that pie that focuses on safety and risk management. Busy slide next, but again, once you get a copy of the deck, you can read it at your leisure. This is, I guess, a preview for some of you of Ontario Health's Equity, Inclusion, Diversity, and Anti-Racism Framework. So there's 11 areas of action. There's no way you can read that small print unless your glasses are brand new, but suffice it to say that it's really about data. It's about the safe collection of that data. It talks about how we can start to highlight and then address the disparities. It also, and what I love about this framework is it embeds the community voice in all levels of the planning. So this is really wonderful that we're calling it out, we're including it in there and saying, you know, no level of the planning would be complete without checking back with communities and providers to hear from them what works. So we're going to talk about COVID, and I know we're all sick to death of talking about COVID, but what I'd love to share about this is what good has come from, managing the pandemic. Here's a bit of a snapshot of some of the utilization of We Speak through the COVID response specific to international agricultural workers over the summer. So you'll see, I don't know if you can recognize me there, all covered in PPE, but this is where We Speak sort of came to life. This project had been underway for years, and we were just ready to launch March 31st of 2020, and COVID had other plans. So what ended up happening was we were deployed out to the farms and out to the assessment center, and we had plenty of people that spoke Spanish as volunteers. We didn't have anybody who spoke Thai or Tagalog or Vietnamese or Haitian Creole. And so We Speak came to life on those EMS iPads. And so this is where we start to see that utilization. We also moved from, because Windsor Essex is so generous, we moved from focusing on Windsor Essex to Erie St. Clair, and very quickly across what we now call Ontario Health West. So Hamilton, Niagara, London and Southwestern Ontario, Waterloo, Wellington. Everyone said, how can we simplify and have access right now? Because we have outbreaks, we have long-term care homes that, received staff from Quebec, as an example. We need help today. And then we'll talk about your strategy. So we definitely want to talk strategy, but we need it right now. So you'll see in this snapshot that we had about 58 languages accessed over the summertime and up until the end of this fiscal year. And so it looked like about 47,000 minutes. So if you can think about 47,000 minutes of better care. And we also very intentionally kept the top 20. So normally you see the top 3 of languages, you see the top 5, but look at that top 20. And there were more. So 58 languages altogether, and so needed. And now I'd like to share a quick patient story. As I've mentioned, we were out at the assessment center in Leamington, and I was deployed as a volunteer, a person who speaks another language. Having We Speak in the back of my mind, but not in my hands, we were asked to use Google Translate for the time being. It's what we had quick access to, and that's what we did. So as an example, I had a migrant worker come through who did not speak English, came all through the different stations, received his COVID test, came back around to my station, where I was filling out the medical information card. One of the questions asked is, can you give me an emergency contact number back home? So if you look at what Google Translate came up with for us, it was emergency contact in home country. So basic information, give me a phone number. If you back translate that through Google Translate, so if you run the Arabic translation back through, it now changes the order and says, contact in an emergency back home. And we frightened the poor guy. So we sort of figured out, oh, we need We Speak and we need it right now because this is a crisis situation. And now he thinks, I don't know what he thinks. He's got COVID. We've got to call his people back home. It was absolutely awful. So, in a crisis like that, and if you can appreciate an entire strategy could be born from one person and their experience, that's kind of what happened. So now we've said we have a solution. Let's get We Speak, and we'll get that app on the iPads in place of Google Translate. Now all of a sudden we have access to 180 different languages live by an interpreter who does not require PPE and brought a human feeling to that experience. And so interestingly, had we implemented this pre-COVID, it may have felt disconnected. You know, somebody on an iPad, are they really there? Or is it a pre-recording? But during COVID, we heard, oh, it's so nice to see someone's face. So that was just an added element. And when I say something good came from that crisis, it was this strategy is on the move. It's made things so much easier. We have some really persistent staff who were saying to some of the physicians, "Hey, give me your phone," and putting it on there, and then all of a sudden they're bringing it back to their organization saying, "I have to have this." So this is one example, and as I mentioned, there's video on demand, there's audio on demand. There is always a place for the live in-person interpreter as well. During COVID, this has been a wonderful sort of a safety net. Thank you so much. Take care, everyone.